Welcome to the Metabolic Link, a medical and science-focused podcast that explores the common thread of metabolism in health and disease. This is where science meets society. Welcome to the Metabolic Link. I'm your host, Victoria Field, co-founder of Metabolic Health Initiative, which is the organization behind this podcast, Metabolic Health Summit, and our CME-accredited platform, the Metabolic Initiative. And we're really here to explore the science of metabolism and its power to transform health, from chronic disease to human performance, through conversations with experts who are really driving the field forward. And today I am honored to introduce a guest who is connecting two worlds we rarely see together: veterinary medicine and metabolic science. Dr. Loren Nations is a board-certified veterinarian and integrative clinician, entrepreneur, and founder of Veterinary Healthcare Associates and Ascend Vets. And over a career spanning more than 30 years in internal medicine, oncology, and cardiology, he's become a leading voice in bringing metabolic, functional, and integrative therapies into veterinary practice. That includes ketogenic nutrition, hyperbaric oxygen therapy, repurposed drugs, microbiome therapies, and botanical compounds, all used to improve health outcomes for animals. But what's remarkable is how his work also speaks to human health. Because as you know, metabolic dysfunction does not stop at species lines. His vision is really simple, but bold: to put a dent in cancer for both people and pets. And today he leads Neoterric, a platform dedicated to advancing pet health through metabolic science and whole being wellness. And in this episode, we're going to explore how veterinary care can teach us about human health, where the science overlaps, and what the future of integrative veterinary medicine looks like. Dr. Loren Nations, thank you so much for joining the show, The Metabolic Link. We are thrilled to have you here to dive into all things pets and honestly beyond.
True. It's an honor to be here. It really is. This is really going to be a lot of fun. I've been looking forward to this for a long time.
Yeah, it's going to be great. I know we've had many conversations before, and I know a little bit about your backstory, but our audience, I know, would love to hear how really personal of a story this is for you, because you started in, as a conventional veterinarian, but morphed into this amazing, integrative, functional, just unbelievable veterinarian that's really leading the charge when it comes to pet care. And that transformation happened from a place that was really challenging. So I'd love to hear your story.
Yeah, thanks. I did. I graduated all the way back in the 1900s. So I graduated in 1991, did a medical and surgical internship at an incredible hospital called the Animal Medical Center, and really was focused on just becoming the very best veterinarian that I could become. And it was all based on allopathic Western medicine. So practiced in that capacity for 20 some odd years or so. And through that experience, I learned all of the tools of advanced medicine from a Western standpoint. And most of those work very, very well in acute cases and scenarios where you need urgent care or emergent health. But what I realized was for the chronic conditions, truly what are now the metabolic diseases that we're faced with, I was not, I realized that there was a gap. So I was looking for some answers. And so I was always very curious, trying to figure out, nutrition and the gut at the time seemed very important, although I didn't understand how. I graduated with a bachelor's in microbiology. So I'm a microbiologist prior to being a veterinarian.
That's awesome.
And oh my gosh, this little gut microbiome story has snuck up on us in this last 5 or 10 years. Yeah. But I understood that there were things going on in the gut, in particular things having to do with food and processing, but I didn't understand it like we potentially are learning now. Yeah. So anyhow, fast forward through me building an incredible hospital designed to elevate the standard of veterinary medicine in a very, very high and significant way. So currently we've got a referral specialty center. We've got boarded professionals that are providing high-end care, 24-hour emergency care, general practice. So we span all of the areas in the highest level that I hope to achieve in that front. Yeah. And at the end of the day, that wasn't enough in some of these cases. So that's my professional evolution to a point. I'll catch up. So come around to, I built my first hospital. We opened it in 2008. At that time, I was shifting, and my personal life changed as well. And I ended up going through my first marriage with the mother of my children, and we ended up getting divorced. And shortly after that, or not so shortly after, but I found another person that was very intriguing, and we became very, very close. And through that, we ended up getting married. And unfortunately, very shortly after that, she found a mass in her breast. And we had it checked out, and it ended up being a triple negative breast cancer, which is one of the more aggressive forms. We did all the things conventionally. This was in 2015. So we're in, an incredible cancer center, Moffitt, unbelievable facility, great physicians, oncologists, surgical oncologists, medical oncologists. And we also were starting to think about some integrative therapies as well. So we did a lot of things trying to augment and get through this process. Everything seemed like it had worked out. About 6 months after, we got clearance, and unfortunately, less than 6 months after that, she was re-diagnosed. Yes. And very aggressive cancer at that point. It was stage 4. It was literally everywhere. It was so advanced. Standard conventional oncology had nothing.
Oh, it's really
and
hard.
At that point, I kind of went into hyper healer mode, or tried. And so I was looking for anything and everything, and had come across podcasts and data points, what I call breadcrumbs, that I started latching onto to try and find solutions or answers. I came about this through Dom D'Agostino's podcast with Tim Ferriss back in the day, like one of the first little data points that popped this thing on the radar. And through that podcast, I started listening, actually reached out to Dom, and obviously we've become colleagues, friends. Yeah. I've treated his animals, so it's kind of odd how all that comes together. But started following these breadcrumbs and found a book called Tripping Over the Truth by Travis Christofferson.
Classic.
Read that and immediately reached out actually to Young Hiko, who was using 3BP. And we went through this iteration. Unfortunately, even despite all of our efforts, everybody's efforts, the cancer was so advanced that we lost an A in 5 weeks. It was very, very fast and very, very devastating to have her go through that, our family, and me as a healer. And I felt like, at that point, the medical profession, human, veterinary, me as her husband and as a healer, we couldn't fix it. Yeah. And that was really, really difficult. And it took me to a very dark place. And the darkness is important because from pain, we find purpose. Yeah. Right? So my purpose coming out of that, I was really, really pretty angry, quite honestly. Yeah. And I wanted to cure cancer. I wanted to figure it out. Like, what the heck is going on? How can we have all of this information and these incredible professionals and, monumentous buildings and have an infrastructure that really hadn't moved the dial on cancer when we started looking over 50 years. Yeah. And so that really, really sent me into this place where I became a student again. And, a childlike mind, there's many different opportunities. With a mature or a closed mind, there's none or very few. Yeah. And there's another phrase that I like by Epictetus that says that you cannot learn, no one can learn what you think you already know. And so really what happened to me from a professional and mental spiritual state was every paradigm that I had thought was true, I erased. And so the book became a blank piece of paper. So I started following these breadcrumbs, and these breadcrumbs led me to Dr. Thomas Seyfried's lecture. Actually, soon after Danae had passed, literally within less than 2 weeks, I was in New York listening to him. And from him, I found this place called Keto Pet Sanctuary.
Yes, that's how we connected.
Keto Pet is where we
and Epigenics Foundation, yeah.
Yeah, so through that process, I just follow these breadcrumbs to Keto Pet and then out to Epigenics in LA with Quest Nutrition. And that was it. And then I started in this integrative path and started going across the fence into the human, or into the human realm, because there really wasn't anything like this in veterinary medicine. Still isn't, yet we'll talk a little bit about that. So that's how I got into this realm. And then very quickly, one of my previous hospital administrators, a dear friend of mine, used to describe me and say that I had confidence disproportionate to my capabilities. Wow. And for me, that I thought that was a compliment.
Yeah.
I was like, yeah, that's I am. She's a Southern lady, and that's kind of a little nice, nasty, like, oh, bless his heart. Like,
You're trying real hard.
I was trying real hard.
Well, it's amazing, though, that you took this horrible tragedy, and I'm so sorry what you had to go through in that process and just feeling kind of helpless through it.
Yeah.
But you've now taken it. And I don't know if at the start it was like, I just want to learn everything I can, maybe not even thinking about applying it to veterinary care, but you just really wanted to understand like what happened here and, could have, we've done something. But kind of what went through your mind? Like, what are the key, I guess, metabolic commonalities between pets and humans? And where was your mindset at that point of like, oh, we have to figure this out and we can potentially apply this to my patients who are animals?
Yeah. I think one of the things that's interesting, it goes back actually to veterinary vet school and veterinary training, in that we deal with multiple species, right? So we have to deal, when we go through our national boards, we have to have the answers for horses and cows and chickens and dogs and cats. And so we're dealing with and have been trained in a sense to look at different systems and what is the similarities and what are the differences. If we think about reptile medicine versus mammals, totally different, but there's many things that are very, very similar. As a veterinarian, my field of vision and my thought process is kind of bifurcated, because I think I'm very interested in the human data, but I've always got in the back of my mind, like, okay, well, how can I apply this to veterinary medicine, right? So there are always those nuances, and the similarities are far, far more significant than the differences. It's kind of like, we have the same machine, but it's tuned a little differently. So when we're talking about different inputs, different drugs, there can be some species specifics. Food, there's a little bit of differences, but there's some pretty unique similarities. That actually becomes a little bit of a challenge, because we can't 100% take everything that's done in human medicine and translate it directly to dogs and cats. And even though that's the case, even in human medicine, that happens all the time without people realizing it. Most of the studies are done in rats and rodents, which are not tiny humans. People. Their digestive tracts are very, very different in a lot of ways. So, we have to figure out and parse and parcel, but so figuring out those pieces.
You know that feeling when your labs come back normal, but your body's telling you something isn't right? That's where Genova Connect comes in. Their at-home test kits that are shipped straight to your door go way beyond standard blood work. They dig into what actually matters, like how your mitochondria are functioning, if you're deficient in any nutrients, what your gut microbiome is doing, and much more. What makes these panels stand out, especially Metabolomics Plus and GI effects tests, is how they translate the data. You don't just get a list of deficiencies. You get the why, the symptoms you might be feeling, and even which foods might help you bring things back into balance. For me, they were a complete game changer. I ran them during a really challenging time with my health, and the insights gave me a roadmap when nothing else really made sense. I actually just took another Genova test, Metabolomics Plus test, recently because I've been breastfeeding for nearly 2 years now, and I wanted to see where do things stand nutritionally, and I'll be sure to share the results soon. So if you're ready to get real answers and figure out what's going on with your health, go to gdx.net/themetaboliclink and use the code metaboliclink to get 15% off any test kit.
That's code MetabolicLink at gdx.net/themetaboliclink for 15% off. Now back to our episode.
It's so interesting because one of, I think, the biggest similarities is, our society is sick right now. Our friends, neighbors, so many people are sick, right? Metabolically sick, right?
Yeah.
And you look at their pets, their companions, so many of them are also sick, are dealing with things like cancer, obesity, all of our problems too, right? So what have you seen in that capacity? I mean, has this been an increasing problem? And, maybe explain a little bit about how you've taken what you've learned from the human side of things, even maybe these studies with rats and mice, but human experience. And I know you went on a trek for quite some time to really pull in all this information, but share a little bit about sort of the current state of the problem with animals and how sick they are right now, maybe why that is, and what you've began to put together to really address the problem.
Well, I think it goes back to me just first starting to try and understand cancer, and that is probably one of the most complex chronic diseases that we deal with. But through the teachings of so many of my mentors, Dr. Paul Anderson, Dr. Naisha Winters, Dr. Thomas Seyfried, Dom D'Agostino, like there's a litany of people that have been kind of paving the way. But basically, all of those conditions have very, very similar root causes. And so as we come down from these chronic degenerative diseases, what Peter Attia calls the four horsemen of death, right? Yeah. There's cardiovascular disease, cancer, neurodegenerative diseases like Alzheimer's, and then metabolic disease type 2 diabetes. Those same things happen in animals. And we are seeing them at an even faster accelerated rate in our pets than is actually occurring in people. So we're like, our patients, our animals are like the canary in the coal mine, and they're living in our environments. They're eating food that's actually even worse than the standard American diet. We can talk about that a little bit. They're exposed to the chemicals, the toxins in our environments. And, for example, obesity, which is the first tripping point of this downward spiral of metabolic health. Our dogs and cats, about 59% of dogs, 61% of cats are considered obese. Wow. And of that, extreme obesity is about 1 in 4 dogs and 1 in 3 cats are morbidly obese.
Oh my gosh.
And they don't have thumbs. They can't get into the refrigerator. They can't call DoorDash.
So what's happening?
So what's happening? So, quite honestly, the food that they're eating is very highly processed for the vast majority of our pets. So when we look at the human diet, standard American diet, highly processed, ultra-processed foods, which is the processing, it's the components, it's the sugars, it's the, the components in it, that accounts for about 53% of an average standard American's diet is highly processed.
Yeah.
That's not so good.
No.
In dogs and cats, it's over 80%.
Oof.
Over 80%. Most of the time, it's almost 100% because they're eating
say.
everything out of a bag or a can.
Right.
And when we think about that, there is absolutely no natural live component that's not highly processed. Mm-hmm. And it's actually not just, there's so many failures or components of that. From a failure standpoint, I'm not vilifying anything that's going on. I'm trying to figure out, okay, well, how do we optimize? Yeah. But there's a failure in providing nutrients that help optimize health, not just barely sustain it.
Right.
And, one of the things that's a little bit of a misnomer is that we've got this label, this AAFCO. It's the Association of Animal Feed Composition Officials, something along those lines. But anyhow, AAFCO was developed, it was founded in 1909, and it was basically for feed for livestock. And so the nutritional recommendations were, how do we prevent disease from occurring to get this animal to slaughter without it developing a problem? And that was it. There was nothing that was designed for health optimization or improving health span or lifespan, quite honestly. And in 1969, they coined nutritionally complete for our pet foods, but it was based on the same standards. So nothing was designed, even the minimum standards for what the pet food industry is, it's not optimal.
Right.
Okay, and that I think is the slipping point.
Yeah.
Right.
Yeah. The nutrition piece, the environment that they're around, so the toxins that they're exposed to.
Yeah.
So how have you've obviously seen this sort of happen over time. Pets are very sick, but you've started to implement a wide variety of metabolic-based therapies and modalities into your clinic, from ketogenic therapeutic nutrition to, vitamin C to even mistletoe and a wide variety of things, which is really cool. Maybe share a little bit about sort of the spectrum of therapies that you're implementing, in addition to standard of care within veterinary medicine, and what you found to be some of the most effective tools that you have in that toolbox.
Sure. Well, I think that one of the key foundational pieces that I realized as I was following the breadcrumbs and trying to figure out how to cure cancer and all those other things is that there were some very fundamental foundational pieces that were being neglected. And, the concept that, following a metabolic pathway to a genetic level, and then there's this one little key that if we can create a drug or compound to turn that off, that it's going to normalize and make that person or that pet healthy or cancer-free or metabolically healthy. It's a pipe dream. That's not the way it works. We're going further from what the body actually needs when we need to go internal. We need to come back to the foundational pieces, literally just of health optimization. And so I think from that standpoint, they're not difficult, radical things that are going to help provide incredible opportunity to optimize our health. And I'm not saying that those things aren't helpful and necessary, because they can really augment, but we got to take care of the care of the being first. Like, we got to figure those out. So, one of the things for sure is nutrition, right? And
that's like first line of defense.
It's low-hanging fruit. And I'll kind of talk through some of the different things.
Yeah,
but nutrition by far, because nobody questions the kibble or the can or what's getting dumped in the bowl. Like, that's
just what you do, right?
And it's kind of assumed that the more you pay for it, the better it is. Now, I will say that nutrition is coming, and it's starting to evolve, and there are now companies that are providing more nutritious human grade type foods. They're less highly processed.
Raw.
Those affect raw. There's a lot of things that I'm going to say probably in this interview and podcast that I do hope that my veterinary colleagues don't beat me to death. But some of them are
right. Raw is a little controversial.
Yeah,
right? Yeah, for
it
sure.
is, and controversy is great because it starts a discussion. What I'll say is things that I look at, and everything that I've done has been very, very driven by science. It's been driven by trying to understand. Literally, it's. I just want to find the truth. Like, what is the truth that's going to set us free? What is it that's going to help us to optimize health and lifespan? And so one of those is food. Hippocrates 2,500 years ago 100%. Said, let food be thy medicine, medicine be thy food. And he also said that disease begins in the gut, which is another really compelling piece of the equation that we'll talk about a little. So I go back to food. And, my standards as far as what we recommend is less highly processed. Okay, so whatever we can do, if people are able to shift completely to a human grade food, there are companies that do human grade foods like what you and I would eat. People can home prepare. We need to be careful about nutritional deficiencies. There's a lot of nutritionists, and there's ways that those can be formulated. Raw is not as I don't want to say that the focus on raw, that there's not reason to be cautious. However, The concern that raw is going to create excessive disease is not because of the fact that it's raw, it's the potential pathogens, and even more so for the safety of the pet parent.
Right.
We don't want people that are potentially immunocompromised coming in contact with some of those.
Just the mishandling of this food
Mishandling.
is
So,
the biggest thing.
but quite honestly, I go back to evolution. Like, what did dogs and cats do? Oh my gosh, how did they get here without humans?
Yeah.
Feeding
They ate
them
rice
bagged
and
foods.
potatoes, right?
Yeah, they've always eaten,
Right.
the canned food, the bag of kibble. And quite honestly, the digestive tracts of animals have extremely low pH in their stomach. So bacteria and a lot of these pathogenic species don't survive. And that's why, dogs will clean a cat box in a heartbeat, right? They'll eat dead food off of the side of the road, completely fine. First thing they do when they see each other is they sniff each other's little rear ends. They're getting a little fecal transplant, a little gut upgrade. So
and they're good to go.
And actually, what's called coprophagy, which is feces eating, is a large part of the animal kingdom, and that's to help the gut microbiome, which comes into this other part of the discussion. So the food, though, is very, very important. So I also recommend or like to gear towards what I call an evolutionarily appropriate diet. So this is where the engine is tuned a little differently. So, humans, we're omnivores. We can eat just about anything.
Yeah.
Dogs are what are called facultative carnivores. They evolved from wolves. They're not wolves. They have had some genetic modifications to be able to process some of the carbohydrates that we have exposed them to over, the last 10,000 to 30,000 years. But it's not their optimal food source. Actually, carbohydrates are an unnecessary or a non-essential nutrient for both dogs and cats. It kind of blows your mind a little bit.
It does, because the majority of kibble is carbohydrate.
Exactly
It's
right.
wild.
It's somewhere between 40 to as much as 60%.
Yeah.
Which is a heavy carbohydrate burden for a person or for a dog.
100%.
And certainly cats, they don't need carbohydrates. No. They really don't. And so they actually don't have some of the enzymes to process those heavy burden, that high carbohydrate load. Their insulin levels, they process all of this extra energy, this glucose, by putting on a lot of body weight. So there's a lot of, we're front loading the machine with just nutrients that are not how the body was designed. Right? It's putting in diesel fuel into a different engine, and it's going to corrode. And
you're just overloading the system at that point.
Yeah, so we try and decrease carbohydrates. Okay. One of the challenges is that the pet food industry really has not mandated that carbohydrates be labeled on the bag. Right. So if you go into any store currently, if you and I go in and decide that we're going to cut carbs and figure out how to lose some weight, right? Can't do that with dogs and cats. You have to get your calculator out, figure out, what the carbohydrate content is.
Which is not very easy to do with those bags.
It's difficult. Yeah, there's a lot of, we'll call it translucency in the information and how easily it is. But when you look on the back of the bag, there's obviously a lot of carbohydrates, corn and wheat, and all the other stuff is in there. And it's a cheap energy source. So, it was used at a time when we didn't necessarily understand nutrition probably as clearly as we do now. It's inexpensive, it's convenient, it can be made very tasty and palatable. So it checks about 3 of the 5 boxes. Yeah. 2 of them are health optimization, right? Yeah. And the other one is probably how appropriate it is.
If your skin's been looking a little meh lately, like dry, dull, stressed, I've got something that actually works without adding another product to your shelf. The iRestore Illumina Face Mask uses a full wrap of medical-grade LEDs, red, infrared, and blue, to fight wrinkles, acne, and inflammation in just minutes a day. It's right here, and it's a wearable. It just kind of goes on your face like this. It's wearable, it's wireless. It works while you do literally nothing. I use mine at night as a way to sort of unwind after putting my son down, and it's amazing. No 15-step cream protocol, no weird smells, literally just light. You simply plug in the cord, press the on button, and you can do it while you're doing housework, watching TV, or meditating. It's literally so easy. And the best part is it works. My skin looks brighter, feels healthier, and it's become my go-to tool for recovery. With the iRestore Illumina face mask, self-care is as easy as it gets. No complicated skincare routines, as I mentioned, literally just results. And for a limited time, our listeners are getting a huge discount on the iRestore face mask with code MetabolicLink at iRestore.com. That's code MetabolicLink at iRestore.com. I know you're going to love this thing just as much as I do. Now back to our episode. So nutrition, it sounds like, is like foundational with all of your patients that come in. What is sort of next? And I'm sure it depends on the patient, right? What they're dealing with, whether it's, cancer, obesity, or just like a well check. What is sort of the next chain of events for you to help the pet parent? Like, hey, this is going to wind up in not a great place because your pet is overweight. Where do you kind of go with them from there?
Yeah. So really, trying to optimize make as many changes with the nutrition. That could be feeding some small amount of maybe there are freeze-dried raw products and companies out there, things like that, just a little bit. It's been found that as little as 20% can give you 80% of the effect of a raw diet. So those can help quite a bit. One of the other things as far as nutrition, we do, and I'll just come back to this real quick because we're on the nutrition thing. We'll talk just real quick about ketogenic diets.
Yeah, that'd be great.
Ketogenic diet is kind of an interesting concept because in veterinary medicine, ketogenic diets are not a thing. And actually, they're potentially vilified because ketogenic diet is a higher fat diet. And fat has been vilified, just like it has been in human health, primarily because of pancreatitis and other conditions. And that's not inaccurate, because the high-fat diets, if they're cooked, high-temperature processing creates volatile fatty acids, very, very inflammatory. So there can be some problems with that, which can lead to those problems. So when we get these higher-fat diets, it can cause disease. Interestingly, in the raw form, there's tremendous amounts of lipases and natural enzymes that do help break down and process. Incredible actual scientific studies and research back in the 1980s looking at some of the most incredible canine athletes, which are sled dogs. They have tremendous amounts of data looking at actually ketone levels and metabolism and inflammatory markers, things like that. And the conclusion is that dogs don't need carbohydrates and that these diets are optimal. So these athletic dogs were eating incredible amounts of fat, meat, and they do just fine. So when we think about that, dogs and cats were designed to eat carnivore, right? Which is essentially a ketogenic diet. So it's almost like it shouldn't be a discussion, but it is. It's a big time deal. So I wish it wasn't called a ketogenic diet. I wish it was called a canine or a evolutionarily appropriate feline diet. But the truth of the matter is that it's not that radical. Most of the things I'm going to talk about may seem or sound radical. They're just radical in the sense that we haven't been utilizing them the way we probably should. So
100%. And it's actually a funny story. I think I might have told you this, maybe not, but my dog, unfortunately, she's no longer with us, Sasha. She was one of the reasons that I got into doing a ketogenic diet myself. She suffered from epilepsy. She actually had a traumatic brain injury when she was very young. And we tried all kinds of anticonvulsant medications. Nothing was working. Nothing was preventing these like breakthrough seizures. And, became friends, Shannon and Ron, and what they were doing at the Epigenics Foundation. And, you really start to learn about its application, ketogenic diet's application in humans for epilepsy, and how, incredible it can be, especially where they implement it in a hospital setting with children who have refractory epilepsy and then use nutrition, and they're able to, in many cases, stop seizures. We were kind of like, well, why, we were actually at the time with Epigenics Foundation using this with dogs with cancer, as you know, Keto Pet. It's like, well, why couldn't you use this maybe for a dog with epilepsy? And so at the time I talked to my vet and they were like, I don't think that sounds like pancreatitis waiting to happen. And I don't think so. That's not really we've never really done that in dogs. But we said, we're going to try it, because I had started my husband had started the diet and was feeling amazing. And we put her on a ketogenic diet and her seizures stopped, went away. We got her off her medication completely. And she thrived through the rest of her life on a ketogenic diet.
Yeah.
And so every time we would go to the vet, they would always ask, is she on a special diet? And I would bring up a ketogenic diet, and there would be like a little bit of hesitation. It was an opportunity to explain, like, she's not been on Keppra, she's not been on all these other things.
Right.
Because we're just using this nutritional intervention that's so powerful.
Yeah.
So you were just explaining, it was kind of this like massive shift for me, because then I said, well, my dog is clearly doing really well. My husband was like, well, so am I. But I'm like, but Sasha's really impressive. My husband was too. He was feeling better. But I said, let's give it a try. And then the rest is history. There's no looking back for me on how amazing it made me feel. But you just brought that up with just some of the pushback that you get, unfortunately. So I would love to hear, your perspective around implementing ketogenic therapy, because I know you use it in, I'm not sure how many different cases, just cancer or just in general, but where you use the ketogenic diet in your practice and what that process has been like as a vet, with other vet colleagues and putting this into practice, the pushback, maybe the obstacles that you've kind of faced along the way.
Yeah. No, I mean, that's a really, really incredible question. And the journey to that really has been through curiosity and trying to figure it out. And a lot of the things, having that confidence disproportionate, there's a little bit of an understanding and not being cavalier in trying things, but if there is foundational scientific reason and even research, most of these things, there's gobs and tons of research if you start digging through PubMed. Yeah. So I did a lot because first and foremost, do no harm. Yeah. The last thing that I wanted to ever do was create a situation where we had done something that was going against my oath as a veterinarian. So specifically for the ketogenic component, Keto Pet Sanctuary was the thing that opened the path for me, because I had heard about this place from Dr. Seafried. I absolutely didn't believe there was a place that was doing that. It was just too lunatic fringe, quite honestly, treating cancer cases with ketogenic diets, hyperbaric oxygen, metabolic conditioning in this facility. I was like, I got to see this place.
So this was like just for our audience who might not know the backstory, but Keto Pet was like this big ranch in Texas where, at the time I was with Epigenetics Foundation, and we would rescue dogs that had naturally occurring forms of cancer that were otherwise maybe going to be euthanized, put them on a ketogenic diet at this location with vets on site, with pet imaging on site, with hyperbaric oxygen therapy on site, and really literally measured every single meal that these dogs were provided and monitored their cancer along the way.
And took blood glucose and blood ketone levels
Everything,
too. Which
to a
was
T.
To a T, like the data, the reams of data.
Yes.
And when I came into this realm, it was about 18 months after Keto Pet had been up and running. So there was a lot going on there. And I walked in, it was like walking into Willy Wonka's chocolate factory. Like, what the hell? What is this place?
Which I kind of felt when I walked into your vet clinic, by the way, because he has a very, very nice vet clinic as well. So in all fairness, but it was, and we'll link in the show description some papers that actually came from Keto Pet Sanctuary.
Yeah.
Really some miraculous cases where you just see, these terrible forms of cancer in some cases, and you're pet negative, day 120.
Pet scans came back negative. Well, the thing that was really compelling to me, because I walked in and I saw this thing and I was like, oh my gosh, what the hell? How many? And I asked one of the folks there, I said, how many dogs are you giving how much pancreatitis do you guys see? Literally,
how are you
like,
causing with these ketogenic diets?
Like what is it, like 15, 20%? Like how often does it happen, right? They said, what are you talking about? I said, pancreatitis. It's caused by high-fat diets. You're feeding nothing but raw high fat. And they said, we don't see pancreatitis. And I was like, come on, no,
right.
It's all right. You can tell me.
You're like, it's okay. You can tell me. I won't tell anybody. No, we didn't.
They absolutely didn't. And that really, really was kind of, again, I'm like, all right. So this childlike mind, all right, how is that possible? And then kind of figuring out how that was possible, and then looking at, what dogs and cats were designed to eat. And so, but that diet was a kind of a fringe. It was a therapy diet that was really pushing, what we would consider nutritional to a therapeutic level. Yeah. But it to me, it showed me that it was actually possible. And the thing that's a little difficult, one of the things the veterinary profession is challenged with, is that the data specifically for ketogenic diets, if you go to PubMed, there's maybe 50 articles on ketogenic diets in dogs. If you go to ask about, do the search for cats, it's like 2, and it's not even about cats.
Right.
So there's really no scientific data out there, so to speak. But when you look, there is a lot of nutritional information back in the 80s, 90s, 2000s showing, it's a thing, but it's not what the pet food industry really is focusing on. So it's there. Anyhow, so that was the first piece to me was like, okay. And then I was using it to treat cancer. And these were patients that were advanced or clients that absolutely did not want to do any type of conventional chemotherapy. And so I was practicing as a referral specialist, seeing internal medicine and oncology cases and some cardiology. Now, I'm not board certified in any of those specialties. I'm boarded in what's called American Board of Veterinary Practitioners, which is species specialty. So my specialty is in canine and feline. But through my experiences and always providing referral care in our community over the previous 30 years in my training, I'd seen a lot. And so I was doing conventional chemotherapy all the time, treating lymphoma cases, all other cancers with the tools that we had.
Yeah.
And then when I started seeing this, I started integrating these processes in. And strangely enough, hyperbaric oxygen, which is near and dear to our hearts, I had an ability to get a hyperbaric chamber in our practice about 2012. So this is pre-everything. So I had actually had the toys and the tool. So I was very interested in that as well. So anyhow, I just started implementing it. And I warned clients, and there was full disclosure, I didn't have a case of pancreatitis. And we started treating 10, 20, 50.
Wow.
We got to about 80 cases where we were full on, like 2-to-1 keto raw. And this was using Keto Pet Sanctuary, the calculator.
Yeah.
Didn't see any cases. I was starting to get comfortable. All of a sudden we had a case that came in and had pancreatitis. She'd been feeding the diet for about 10 days, and then all of a sudden came in and had pretty bad pancreatitis. I was like, oh, shit. As it turned out, she freaked out that it was raw, and she cooked it. And we've had 2 cases, and it's because the clients cooked the food. But in its natural state, and we've had hundreds and hundreds, hundreds. And I use that. So to answer your question, I use that specifically therapeutically for cancer, and we manipulate the protein and the fat a little bit. I use it for a lot of metabolic conditions with dogs and cats, and even things like inflammatory bowel disease, which sounds like, oh my gosh, like you're using a high-fat diet for. And really it's the carbohydrate content that we're trying to control, and part of that is because the microbiome, which we keep scooting around that little discussion, the carbohydrate burden can lead to overgrowth of different bacteria that are not necessarily natural, that could potentially lead to and cause some of the inflammation that we're seeing, the dysbiosis. So when we're trying to manipulate and use, so we've got a little bit of ground to cover in pulling all these pieces together. So nutrition is one of the key pieces.
Let's talk about gut health, energy, and skin. And no, this is not just another supplement plug. I'm talking about living tea, specifically the Pu'er teas from Peak. These are fermented teas packed with prebiotics, probiotics, and postbiotics all in one. Think metabolism, gut, and immune support in every sip. If your goal is to balance your gut flora for better digestion, protect your cells, and support healthy aging, Pu'er teas are for you. Every sip leaves you feeling vibrant and alive. They're literally amazing. Nourish your body from the inside out with living tea. And when you grab the Pu'er bundle, you'll unlock 20% off for life, receive a complimentary gift, and gain access to the ancient wisdom behind their teas and wellness rituals. Discover it all at peaklife.com/metabolic link. That's PIQUELIFE.com/metabolic link. I know you're going to love them just as much as I do. Now back to our episode.
I'm going to go on a little bit of a rant here.
Please give us like the modalities and how you kind of bring
how
them.
I think about it, okay?
Yeah,
so we've got this organism, our metabolism the creation of energy that sustains life. And the more energy we produce, the higher the function of our body is. And so everything that we're using is trying to optimize metabolic performance or optimization, energy, mitochondrial function, and the nutrients and the components that go into that engine are going to create that energy output. So food, we've talked on that quite a bit, is very, very critically important. The gut microbiome, which is now this discussion about the entire ecosystem of bacteria that reside in our gut, is so much more important or untapped. We have no idea. Yeah. And coming from a microbiology background, it blows my mind, the amount of information and the stuff that we know now. And that comes because of RNA gene sequencing. You can take a little poop sample, run it through a machine, and get a printout of thousands of different bacterial species now. And now the databases are starting to create what appears to be somewhat optimal or what would be healthy in a metabolic condition. Unfortunately, when we think about an extremely highly processed diet, no live component, our animals are living inside. They are not even able to go outside in the dirt in a lot of instances. So they're in a sterile environment from a microbial standpoint, so they can't upgrade their gut microbiome. They have no input. So what they've got is all they get. And as we kill that off, it becomes destroyed. And now we have this incredibly imbalanced gut ecosystem, which is doing the heavy lifting in digesting our food.
So disaster. Yeah.
So it's a disaster. So we have the food component. We have a gut microbiome that is so out of balance. It's this incredible ecosystem. It's a living ecosystem. I describe it like the Amazon rainforest. And the thing that's so compelling, which we're just starting to figure out, is that each of those little 1,000 species that are in our gut have individual little functions. So some of them do things like actually create antibiotics that control the bad bacteria. So they keep the bacterial overgrowth under control. Some of them communicate directly with our immune system that lines the gut. So they're giving signaling molecules. They're telling our internal environment what's going on in the external environment. Some of them are actually creating neurotransmitters, neuroendocrine components like melatonin and serotonin, which through the gut-brain axis is now communicating with our brain, which is creating our mood and things like euphoria or wellness in a healthy gut becomes depression and anxiety and other mental health challenges in a disease process in our gut. So with animals, this behaves and creates the exact same things. So behavioral problems in animals, chronic gastrointestinal issues. When I graduated vet school and started practicing, every single cat vomited, and that was normal. Yeah, cats vomit. They have hairballs. So we'd give them Laxatone and try and treat them for vomiting. It all comes back to the gut. And the third component, I'll come back to that, but when we have that dysbiosis, it's a result of the food, the input, the chemicals, compounds, processing, and then this dysbiotic, imbalanced gut population that now leads to inflammation. And that's the term called leaky gut now, which is kind of a simplistic understanding. But that leakiness now allows different components into the lining, which then stimulates our own immune system. 70% of our immune system lies in the gut. So that right there is the foundation to chronic inflammation, which leads to all the other dysfunctions that we're dealing with. So I go back to that premise for almost every single case I see, whether that's a cardiology case, an internal medicine case, an oncology case. We got to go back to the gut, because if we can't heal that, our body has no opportunity to do what it needs to help minimize or help heal any of those systems. So that's kind of the foundation.
So it's nutrition, gut healing. Some of those are two big staples, it sounds like, for you. How are you approaching the gut healing side of things? Obviously you've got like the quality nutrition, but is there anything specific, pre-probiotics, what's your approach to that?
Yeah, we're very fortunate. In veterinary medicine, we have there's information coming out. There's a company called Animal Biome, which actually allows us to do gut testing with stool samples. So we get these reports. They're kind of truncated, but functionally they're headed in the right direction, and we're starting to collect data and understand. The other thing that we end up doing is replenish that gut bacterial population. So people. Fecal transplants are the new thing, and it's an FDA approved.
And you're doing that in pets?
Yeah.
That's awesome.
Yeah. So,
and what are you seeing? So you're focusing. Say you have a patient that comes in with cancer, right?
Yeah.
Obviously nutrition is going to be a big piece in healing the gut. What is your step-by-step process, and what are you seeing in many of these patients once they've implemented these therapies?
So basically what we do is we come to the gut. Okay, so we start foundationally. I'm going to try and do what we can to optimize nutrition. Okay, that's primarily going to be some type of lower carbohydrate, less highly processed, potentially ketogenic diet. Raw is not it's not a negative in my practice when we use it appropriately. So we do that. We address the gut microbiome. So we do testing, then we optimize. We've got to replenish. We've got to allow that gut microbiome or the flora to become optimized. So and we need to give back. And people using fermented foods, things like that helps. We don't have any of that in veterinary medicine specifically, but through different components and companies, probiotics, which are live bacterial formulations, can be given. Fecal transplants are something that we're starting to do. I've done, a number of those in our cases. We also have, through this same company, they have gut restore capsules. So they're enterically coated. They're little poo pills.
Nice.
So
that's awesome.
It's kind of like microdosing.
Makes it a little easier.
Yeah, it's a little
right?
easier. And we use both, and those can actually be quite effective. So we'll try and get those bacteria back into the gut. And the reason that that's important for a probiotic is that a lot of the probiotics that are out there are very, very truncated. There's 3 to 5. It's a limited number of species with very, very high bacterial colony-forming units, 20 billion colony-forming units or whatever.
Yeah.
And so that's actually creating some imbalance. We're not optimizing.
Right.
So to replant that field, to reseed the soil, we need to give a full biodiverse probiotic supplement. And so that's where that comes from. And then there are other things that we can use, fiber sources, postbiotic therapy, stuff like that. That helps. That's the fertilizer for the bacteria, right? So we're getting all that optimized. The next thing, sometimes we will use anti-inflammatories depending on how severe. Conventional med uses prednisone and corticosteroids and all that stuff. Very highly effective, right? Yeah. Problem in just that scenario is that we're just treating a symptom. We're not identifying that underlying cause, right?
Right. And you can have some blood sugar issues and whatnot.
Absolutely.
Things, yeah.
We do testing for different vitamins and minerals, B vitamins, cobalamin, folate, vitamin D is becoming much more important, magnesium, looking inflammatory markers systemically, C-reactive protein, all of those things, and then optimizing those. From there, we will start layering in potentially some natural compounds. There's plant compounds, there's mushroom compounds. A lot of people have heard about turkey tail mushroom, Coriolis. Those can be very potent anti-cancer allies. So we use a lot of supplements, curcumin, turmeric, green tea extract.
That's great.
So these are all natural compounds. Then the next realm that I start thinking about are what are called repurposed drugs. So these are the metformins, the ivermectins, the fenbendazoles that everybody's talking about, and there's a place for those, quite honestly, and we use those in some of our cancer therapies. We developed and have started using a protocol that was developed by a cancer clinic called Care Oncology Clinic in the UK, probably 10 years ago. So there's a number of different compounds that we know that have specific anti-tumor or anti-cancer effect that will target the cancer as well as try and help the body. So we're coming at it at both. Like, we don't neglect the cancer, and we don't expect just the natural therapies to necessarily get everything back in control if the cancer's a raging forest fire.
Yeah.
So we've got to treat both.
It makes a lot of sense.
And then hyperbaric oxygen.
I was just going to say,
Yeah, so then we've got a whole bunch of other things. And we've got things like hyperbaric oxygen.
For cancer.
For cancer. Hyperbaric oxygen, it basically we're super oxygenating the body for normal healthy tissue. Absolutely loves it. Doesn't have any adverse effect whatsoever. Action can be stimulatory. Cancer metabolism creates an environment that's very hypoxic, and cancer doesn't necessarily like a lot of oxygen because it creates reactive oxygen species or free radicals, which can be very damaging. So it overwhelms, it creates a scenario where the cancer is now struggling. We also combine hyperbaric with high-dose IV vitamin C, right, which is another one. And we know that that is a very potent oxidative stress to cancer cells, and particularly not to normal healthy cells.
Right.
So we actually combine hyperbaric oxygen with high-dose IV vitamin C in a single therapy that acts like a chemotherapy. It's like a metabolic chemotherapeutic treatment. It creates a very potent oxidative burst, which cancer does not like.
And I'm sure there's very specific dosages of these things, because I know you can almost create a scenario where you have, too much of a good thing, and it can actually speed up the process of necrosis. Yeah. So I'd love to hear your thoughts on that.
Yeah, so
dosing.
traveling in these integrative oncology circles, Dr. Paul Anderson and Dr. Nasha, they've been using these. Dr. Scher, who you interviewed, Paul Harch, who's kind of the founder of Hyperbaric, was one of my mentors, and I got a chance to sit on the board of directors for the International Hyperbaric Medical Association for Humans.
Wow.
But anyhow, so understanding these, there's a little bit of nuance. It's kind of tuning the machine and understanding how those work. But they're very, very safe, and they can be quite effective. And what I've found is that, we're trying to optimize a patient's health. And as a young metabolic practitioner, when I say young 10 years ago, I'm not young now. But,
you're spring chicken. What are you talking about?
But anyhow, I just wanted to cure it.
Yeah.
I wanted to get rid of it. It was one of those things. I wanted to put a dent in cancer.
Yeah.
And now you can live with cancer or potentially cure it. But if we're able to optimize the environment and claw back good quality of time, we don't know how long any of us are going to live.
We're all dying, right? Yeah.
Exactly. And in veterinary medicine, in oncology and veterinary medicine, we definitely treat for quality of life. We don't sacrifice for quantity.
Yeah.
So that's a focus. And all of these things metabolically, all we're trying to do is optimize our own energy, our own health and vitality.
Right.
That's the key to medicine, is restoring balance. And so all these different functions, or all these different ecosystems that are within us are now starting to be tended to. And when we pay attention to those, the changes in the vitality of the patients that I see is miraculous. Like, we see little feeble cancer, dogs and cats that are just kind of eaten up. And you think, oh my gosh. And they're just, you don't know how tired they are. And then we start getting them on a diet, and then we start cleaning up their environment, and their diarrheas and their allergies start, healing. And then all of a sudden they come in and, oh my gosh, doc, I saw my cat play with a toy. She hasn't done that in 10 years.
Aww.
Or dogs are able to jump up and down off the couch, and they're getting zoomies back again in the kitchen or whatever. It's just like, and these dogs that come in with cancer.
Just riddled with it.
Yeah.
And what's that like for you as somebody who's gone through so much hurt yourself and is seeing this happen in your own practice?
It is, first of all, it warms my heart. It gives me, sorry.
No, you're okay. I'm going to cry with you.
It gives me tremendous hope.
Yeah.
The reason is that as I came into this realm, it's a very dark realm. The realm of disease it's not fun, right? Yeah. Disease is not something that any of us want us to experience, and we're all experiencing disease on some level, where we actually have a true manifestation of a severe cancer or neurodegenerative or some process. We're all dysfunctional to a degree.
Yeah.
And the ability to go into this realm, completely turn the lens of the camera and the paradigm of how health should be provided, right?
Yeah.
And to see the dysfunction on one side, step through the portal of pain, come out on the other side. It's cool.
Got to be amazing. And
it is. And the thing that is so inspiring as well is I get to work on pets. Right? They're my passion. We've all got heart animals, dogs and cats, but I also love people. And so through what we're able to experience, the pet is not the only component. It's the family unit. It's the pet parent. Like, that's why they're here. In my profession, we get to help both.
Yeah.
So
I'm sure you're inspiring the pet parent at the same time. They see the transformation, much like myself.
Yeah.
I saw in my own dog, Sasha, in literally becoming seizure free. You have, I'm sure, pet parents that are maybe seeing their little ones do the zoomies again when they literally didn't really have a will to live at one point.
Yeah.
That's going to influence somebody in such a positive way to be like, maybe I should be making some of these changes to support my own internal health, like what Dr. Nations is doing for my pet.
Yeah, that's
so
exactly it.
You got to be so proud of what you've created through your clinic. It's such a ripple effect beyond just the pets that you're touching.
The thing that's so foundationally crucial is just the understanding of us going back to nature, right? We've just got to go back to the foundational pieces. And, you know, what I'll say specifically to pet parents, 20 years ago, I would ask a question from the veterinary profession. For me as a veterinarian, I had this question that popped in my head, that if a pet parent came to me with a new puppy or kitten and they just lost one of their heart animals, right? We all have those heart animals that leave paw prints on our soul. And they had gone through the pain of losing that, but they had this new life. And they came to me and said, look, Dr. Nations, we just lost, Stella or whoever. I want to do whatever I can to optimize, Charlie's life. What do I need to do so that Charlie can live to be 20 and be disease-free, right? That was the question. And I didn't have the answer. And now I do, right? And it's the same answer that goes for people. Machine's the same. Right? So all of the information that's coming through metabolic health conferences and podcasts and healers in research and in human medicine and oncology, all of these different areas, functional medicine doctors, that's where the answer lies. And the answer lies in coming back to the basics. It comes back to the microenvironment. It comes back to Mother Earth, quite honestly, and the food and the soil. And as we start paying attention to what's internal to us, then that health and vitality will come back. And so that's the area that we now have an ability to make some changes. We have ability to make changes in our own lives. We have the ability to make changes in our children's lives and in our pets' lives. And they're the ones that don't have a choice. Like, they rely on us. And as we take care of them, then we also learn about how to take care of ourselves, right?
So true.
So the love that they give us is their gift to us. And when we acknowledge that and we try and give that back in the form of good health and vitality, then the entire ecosystem and community wins.
That's so true. You couldn't be more spot on with that. Before we go, I want to quickly mention to those watching that you actually have an opportunity to ask Dr. Nations some questions live. We do have a live Q&A coming up.
Oh, fun.
Yeah, in November, right? So we'll link to that in the show description. But before we go, Dr. Nations, tell us about Neoterric and how that was created, why that was created, really from a space of wanting to do so much more within the pet health and metabolic connection. So explain that to us a little bit.
Yeah, so Neoterric, back in 2015, as I was envisioning how to change the paradigm, I had this notion of creating a metabolic health institute. And so that was really trying to figure out scientifically, how do we create research and understand the process? What would that look like? And it not only was a research institute, but in my mind's eye, it was the ability to bring like-minded professionals, healers into a space where we could all figure it out. And that became manifest about a year ago. So I had the opportunity to bring on one of your colleagues, Dr. Shannon Kessel.
Yep, love her.
She was in the trenches with you back with Dom's lab, and more recently, Dr. Sarah Moss. So we now have two PhDs and a veterinarian, and we decided to create an organization that would focus on pet health and metabolic pet health, what we're talking about here. It's called Neoterric. In that, we're doing nutritional information. So there's a pet parent platform that'll be launched. It allows you to get information on the how-tos of some of these metabolic principles. It'll be a playbook, so to speak. It doesn't necessarily replace veterinary care. We definitely are mindful of all the things that need to be done in that realm. I'm still a veterinarian and I practice every single day, almost. Yeah. So we've got a pet portal for people. We've also got a nutritional supplement line that's coming out as well. Okay. This is based on these fundamental principles. How do we use some of these other supplements? How do we optimize the nutrition that we're putting in? So we've got products coming out for what we call the Core 4.
That's great.
And we've got a dog line coming out first. Our cats are not being neglected. I'm actually a cat dad now. I have 5 cats.
Oh my gosh.
I'm dogless, awesome. Which has never happened that I remember. We're looking for another dog, so I'm a full card carrying cat dad.
So you're a very busy man between all the things, your clinic, you Neoterric, cat dad, all of it.
All of those pieces.
It's amazing to hear more about your practice. And I know I've been there and seen your team in action. It's really unbelievable. And just the good that you're doing in the world is truly something that you should be so proud of. And we're loving following your work. And I feel like I could talk to you for another hour about this.
Yeah, we'll have to do it again for sure. There's so much more stuff that we can talk about.
100%.
And we're just getting started. I mean, I will say that in my profession, my dear profession of veterinary medicine, we lag. We're probably 5 to 15 years behind. Yeah. Just because the dissemination of information, it takes a lot longer. But hopefully we're part of that conduit, the bridge.
Yes.
I've spent a lot of time in the human trenches, so trying to bring that over to my veterinary colleagues and the veterinary profession in some form or fashion that is helpful for our pet parents and our pets.
You're doing a phenomenal job with that. You're leading the charge when it comes to really cutting-edge veterinary medicine that's really making an impact, not just on the pet side, but on the human side too. And now in the education piece as well with Neoterric. It's just it's really inspiring to hear what you're doing. And thank you so much again for being here, part of the show on the Metabolic Link.
It. I think it comes down to 2 things. One is a childlike mind and curiosity, and 2 is that confidence disproportionate to capabilities.
I love that. I love that. Thank you so much, Dr. Nations.
Thank you.
Thank you so much for watching and listening to this episode of The Metabolic Link. Dr. Nations is a true pioneer in bridging veterinary care with the front lines of metabolic health. His work challenges the siloed mindset that keeps human and animal medicine separate, and his mission to improve outcomes across species is nothing short of visionary. If you want to dive deeper into what Dr. Nations is building, check out the show description where I'll put a ton of notes on links on Neoterric, Ascend Vets, and the metabolic therapies he's integrating into veterinary care. Again, if this episode gave you something to think about, please share it with someone who might benefit. Leave us a review, and don't forget to hit that subscribe button. It really goes a long way. And if you want to see even more content like this, exclusive content, head to membership.metabolicinitiative.com. That's our exclusive platform, the Metabolic Initiative, where we host hundreds of videos, resources, and deeper ad-free episodes of the Metabolic Link. Thank you again for being here with us, and we'll see you next time.
Do you love learning about metabolic health? So do we. It's why we created the Metabolic Initiative, an online educational platform providing evidence-based education on metabolic health and therapies for healthcare professionals and the general public. By joining the Metabolic Initiative, you'll gain access to hundreds of expert lectures, interviews, panel discussions, and even private episodes of the Metabolic Link. CMEs are available. Go to metabolicinitiative.com to get started. And as always, thank you for listening to the Metabolic Link.